we need to get you, because the most likely place for this to be coming from is your tongue base or tonsil area, and you do have a little bit of calcification in the opposite side tonsil. It can cross the midline and go to the opposite side lymph node. So your right tonsil seems like the most likely culprit. And usually what we do is have a good look around the whole upper digestive tract, the whole tongue base, vocal cords, down your esophagus and into your lungs, looking for any other primary tumors, because you can have other primaries when you have squamous cell carcinoma. We want to exclude that. And then take your tonsils out. That's what I'm proposing that we do.
Okay.
As soon as we can get you on the schedule at the hospital. So a bit of a change in original presentation, and we were thinking this was more of a lymphoma type presentation. But you know, when I saw that necrotic appearance on CT and we weren't getting anything on the needle aspirate from the office, I said, let's try another time with needle, because I don't want to be in your neck screwing up my plans for a neck dissection if I need to down the road. Because I'd like to go into a virgin neck whenever I possibly can if I'm operating on the neck. So, so happily the needle aspiration got the answer we needed. Now that helps me know where we're probably looking. I'm going to get a PET scan first to help guide the questions about tonsillectomy, and most of all because it's a chore to get through a tonsillectomy, but you might not be needing one. So the PET scan will help me know if that's needed or not.
Okay.
I'm leaning towards it coming out anyway based on the CT appearance, but if it doesn't light up at all, I may have a different feeling about it. So
Okay.
So how soon is all this gonna happen?
as soon as we can arrange it, you know, I'll get you your priority on my schedule
Okay.
while you're here.
So what is this anyway? What kind of cancer and how does
Squamous cell
this?
carcinoma is coming from the throat, the lining of the throat.
Okay.
So it can be a tobacco-related cancer. P16 positivity is usually the guide to it being HPV-related. You weren't P16 positive, so it doesn't appear to be a human papillomavirus-related cancer.
Mm-hmm.
That's the next most likely thing.
Uh-huh.
So I'm left with it's a tobacco-related cancer. You have just faulty genetics, you know, and you're one of the rare birds who have really no risk factors but still got a squamous cell carcinoma.
Faulty.
Yeah, I don't smoke.
No.
Right.
So-
Were you around secondhand smoke a lot as a kid by chance?
No.
Yeah.
Been at the golf course. With
I
all
went
this stuff at
I
the
went
golf course.
through a brief time where I smoked some cigars playing golf, but it was like brief.
In your 20s or
No,
30s.
that hardly rates.
Yeah, I mean
No, he's not a-
it was like
he's not a
only if I
drinker.
was golfing and
You
being
gotta be
stupid.
smoking a pack a day for 20 years to really get my
Oh,
attention. You know,
No.
not doing
I have
that.
a ton of patients who smoke. That's a 20-pack year history. Okay, I have a ton of patients who are well over 100-pack years, even 150-pack years of smoking. That would take 30 years of 5 packs a day.
Oh my god.
Okay, so you know, you're not. That doesn't rate. What you had doesn't count.
Uh-huh. Well, normally, okay, so
So it's
you take this out, you take my tonsils out.
Which is
Then
to stage
what?
you. Stage you. That's all that does. Gets us you clinically stage for where your cancer is coming from and how far along it actually is. Then we get into treatment with chemo and radiotherapy.
And the PET scan is the whole body or just the head?
Skull base to thigh. That's how we tend to do
Skull
those.
base to thigh. Okay. And how long do you think this, just in your judgment, professional opinion, how's this been an issue?
Months.
Just months.
You know, how many is anybody's guess, but months.
So they don't know what caused it at this point.
Nope.
Yeah.
You're not
Look
a
at the
smoker. You're not a smoker and you're P16 negative. That's the most help we get on that one.
What's P16?
Human papillomavirus.
Oh,
Yeah,
okay.
HPV.
All right.
That's the fingerprint that virus leaves when it damages the DNA, and then we can kind of, okay, you know that you're an HPV tumor, which I would kind of wish you were because it's better prognosis. But you know, right now we're just going to have to deal with what we got in front of us, and it may be that at the primary site we find P16 positivity. part of the problem with the needle aspiration is there's limited tissue there. So, sorry in advance, but you know when the procedure comes, you're gonna hate me for a while. It's gonna be sore back there. You're gonna have a hard time with eating and drinking for a while. It's because I want to bite the living daylights out of wherever it is and make sure we get tissue.
Yeah.
So.
So we'll do this. How long are you down when you have that? What are my restrictions?
2 weeks, no bending, stooping, lifting, sports, avoiding blood thinners beginning a week before surgery, so no Advil, Motrin, or aspirin. So stay within 20 minutes drive of the hospital, need a soft diet like mashed potatoes, yogurt, pudding, smoothies, and milkshakes for about 2 weeks.
Okay.
What hospital do you go for?
Franciscan?
Okay.
Yeah, so for what it's worth, that's what we found.
All right. So you take these out, and then what? Hopefully you got it all.
No, that's not the point.
Okay.
The point is not to get it all. We're not even aiming to do anything surgical. You do not want me to get it all if it's your tongue base, because if I get it all, I'm going to take your lingual artery with it and all kinds of very important structures, which would increase your risk of major complications. There is no way to get it all when it comes to tongue base.
I know.
We don't treat this disease surgically. We treat it with chemo and radiotherapy.
Okay. I have a friend of a friend who had to have his tongue removed, and
Yeah, we're not talking about glottic carcinoma. We're talking about tongue-based carcinoma.
okay.
So your friend had his tongue out, and told me to cut within the anterior 2/3 of the tongue. Okay.
Uh-huh.
If yours is anywhere, it's back here, or as I said, in the tonsils. And so for this, all we can ever hope to do is just get a bite of the surface of the thing and know, okay, all right, it is tongue based. Okay, then we know where we're going to target our radiation, and etc. So,
Okay.
All right. So will I be able to work?
for 2
I
weeks.
mean, I'm an office job. I mean,
For 2 weeks, you're not going to feel like doing much. You're just going to want to recover.
Okay.
During chemo and radiotherapy, you're not going to feel great.
Mm-hmm.
You're probably going to want to take 3 months off if you possibly have short-term disability. Do you have it?
I don't know. Like Aflac or something.
Okay.
I don't know.
What do you do?
I work for Wabash National. I'm a buyer.
Okay. So, what you find contracts for them to drive around? Is that what you do?
No, I buy all the parts that.
Oh, I see.
I
You
buy
actually
parts
work for the building. Of
Yeah, to make the
actual
trailers. Like
trailer.
I buy all kinds of
Got it.
material.
Okay. So you can probably do that work when you're not in pain. You do not want to be doing any kind of important judgment work when you're on narcotic. And for a good 24 to 48 hours after you take your last dose of narcotic, you should not be signing anything, calling anybody, any customer that you ever hope to see again.
Hey, send us in £1 million of this.
Right.
Whoops,
Who
I
is this-
didn't mean $1
Who is this
million.
crazy guy I just spoke to?
Yeah. This is
Yeah.
not normally his order.
Yeah.
Right. So that's kind of the general gist of it.
I mean, is this something that will kill me?
Yeah, it can.
Okay.
Will? Only God knows that one.
That's
Yeah.
right.
No, I mean, it's entirely treatable.
Okay.
And right now, I mean, you've pounced on it. Good job noticing the lymph node and not sitting on it, hoping it would get better. That was good.
I mean,
suspect this.
I waited a little bit.
That's right. I was like,
Well, I waited a little bit,
you
but
didn't
not
even
by.
tell me. And I'm like, oh my gosh, no, you are not waiting.
Oh, it's-
Yeah.
So yes, we pounced on it. Or I pounced on it as soon as I knew.
So that's what we got so far. I didn't want another day going by before you
Mhm.
knew that much and get the ball rolling.
Yes.
Intervision will be in touch about the PET. Okay.
Mm-hmm.
I want that before I operate on you because that's going to help me guide what I do when I operate on you.
Okay.
Okay.
We're going to get you on the books for some time on the heels of that. We need a COVID test. That's just still the nature of the beast.
Okay.
So we'll try and keep you informed about exactly when those things happen. So just keep your phone on.
Oh, yeah.
On
That's
checking
fine.
messages and stuff.
Yes.
Obviously, I will.
Good. You'd be surprised how many people. So
No, we're gonna
Well, I
Okay.
got two phones on me at all times,
Good for you.
unfortunately.
No, well,
It's your lifeblood for your job.
Yeah, work phone and then my own phone, which is my lifeblood for my
yeah. All right.
living.
So did you have those papers then, Jim? Oh, I thought you.
Oh,
Let me
is there
give you-
anything you could give me about this?
Yep, you
Yeah.
can. Your wife to read it. And you can
Yeah, I
read it.
like that. Yeah. Okay, thank you.
So, if you have big questions after the pet, we can talk by telephone. I don't see a lot of point in meeting to discuss again after the pet. You already know what
Yeah.
the general plan is.
Okay.
Yeah.
But if
So
there's,
do you think it'll be this week or next week for the PET scan?
I would hope that it's an
Today's-
issue getting a prior auth.
Tomorrow's Wednesday, yeah.
Yeah, it may be next week before it's prior auth, but
Uh-huh.
it'll be early next week. Usually it's somewhere around 5 days is typical.
And then after that, then,
Then surgery. So
which usually takes, so it could be a couple weeks.
could be.
Okay,
Which is why I don't like losing time at this juncture
Yeah.
because I know that I can start the process. now.
Right.
As soon as I have tissue, I can't hope to get a pet until I've got something that says cancer on it. The
mm-hmm,
moment I have that, it's almost airtight that I can get a pet. It's a black and white thing. They
Of
will
course.
almost never prior auth a pet on
mm-hmm.
the impression that there's something.
On a
cancer.
whim.
Yeah.
And the medical judgment doesn't matter one iota. Tissue is
Mm-hmm.
runs the world on that one. Once we got that, we can start the ball. So that's why I want to get you in so we can get this going.
Okay.
So we would
Yeah,
have
we
no
want you
clue
to.
what caused it. Just
Yeah, you already got your answer on that one.
Yeah, you got your
there is no answer.
Thank you.
Thank you.